And as more and more Americans get their vaccines, data is showing that some minority groups are being left behind.
Our Lauren Coomer spoke with the healthcare system about what they're seeing and, better yet, how they're trying to help bridge that gap. Lauren?
Yeah, Doug, Annie, statewide data shows around a 39% gap between white and black residents who have received their first doses of the COVID-19 vaccine. One healthcare system saying they too are seeing vaccine disparities and something needed to be done.
I forgot to scream.
Just like with the COVID-19 testing and what we saw earlier on, mortalities, there were disparities between our people of color, our indigenous folks, and those that are white. Those same disparities pulled through in vaccine distribution.
Beth Washington is the Vice President of Community Health, Equity, and Inclusion at Bronson Healthcare.
Hi, go ahead and have a seat. This is Penny and Nicole.
While the hospital has been continuing to vaccinate Michiganders, she says after looking at the data from the first 4 clinics, they realized something was wrong.
We could see our disparities. About 98% in those clinics were white folks versus our people of color and indigenous folks.
Ready? 1, 2, 3.
State data shows about 43% of first doses administered went to white residents, while 3.7% was received by black residents and 9.1% for residents of other races. Within the same data, about 43% of people did not report their race. In an attempt to bridge the gap, the county health department is reaching out to community groups that can help.
When we saw that initially, we said, okay, where are people? Who do they trust? Who do they work with? And let's partner there. We can't solve it all. How can we do this as a community to make sure that we do vaccinate all of our folks?
So it's gratifying to actually have it in the community where blacks are most prevalent, and they actually have access to it. Heretofore, oftentimes they don't have the access. But this is access, this is a place they trust and people they trust, and so they're more apt to come in here and to get the help they need.
Mount Zion Baptist Church's pastor Addis Moore saying the proof is there when it's at a place people of color trust, with more than 500 people receiving it at just one vaccine clinic in the beginning of February.
I can tell you through that I know people who are saying they want the vaccine, they truly do and are getting it. We still have a lot of work to do as a community to make sure that that continues to be the case.
Bronson Healthcare also saying although it's not available to the younger population just yet, early studies are showing in young black, brown, and indigenous communities there's a lot of hesitancy to get the vaccine. That's why they're continuing to work with community partners to make sure there's education and availability for those who want it. Reporting live in Kalamazoo, Lauren Coomer, Fox 17 News.
All right, Lauren, thank you.